Blood pressure, a key indicator of cardiovascular health, especially in the elderly. According to the American Heart Association, AHA, Harvard Medical School, the American Heart Association, and the National Institutes of Health (NIH), the ideal blood pressure level is defined as 119/79 mmHg or lower. Maintaining this level helps reduce the risk of cardiovascular diseases, strokes, and kidney failure, common health concerns among older adults. Why is this blood pressure level considered ideal? Medical research has shown that the higher the blood pressure, the greater the risk of heart disease. Maintaining a blood pressure of 119/79 mmHg or lower provides several key benefits. Heavy checkmark reduces stroke risk. High blood pressure increases stress on artery walls, raising the likelihood of blood vessel rupture in the brain. Heavy checkmark protects the heart. Stable blood pressure prevents the heart from overworking, reducing the risk of heart failure. Heavy checkmark preserves kidney function. High blood pressure can damage small blood vessels in the kidneys, leading to kidney failure over time. Heavy checkmark prevents eye complications. Hypertension can affect the blood vessels in the retina, causing vision impairment. Changes in blood pressure standards over time. Blood pressure guidelines for older adults have evolved significantly over the years. For example, 1980s to 1990s, a blood pressure level of 160/90 mmHg was considered the threshold for treatment. 2000s, the standard was lowered to 140/90 mmHg, especially for individuals under 65. 2017, a study of 9,000 people over 50 found that maintaining blood pressure close to 120/80 mmHg significantly reduced cardiovascular risk. As a result, 119/79 mmHg or lower is now recommended as the ideal blood pressure level for older adults, helping them maintain good health and lower the risk of serious illnesses. Why is there confusion about normal blood pressure levels? Despite major health organizations, such as the AHA and NIH establishing 119/79 mmHg or lower as the ideal blood pressure level, confusion and debate persist. This uncertainty arises primarily from three key factors. 1. Outdated information on the internet. Today, when searching for information about blood pressure, many people still come across outdated medical documents with guidelines that are no longer accurate. For example, before 2017, a blood pressure level of 140/90 mmHg was considered normal for older adults. As a result, those who rely on outdated information may unknowingly accept an inaccurate blood pressure range, leading to either complacency or unnecessary concern. Some websites and medical sources that have not been updated also contribute to this confusion. This is why older adults and their families should refer to trusted medical organizations and cardiologists for the most accurate guidance. 2. Differing opinions among doctors. Not all doctors agree with the new blood pressure guidelines. Some believe that 119/79 mmHg is too low for older adults, especially those who have had high blood pressure for many years. They worry that lowering blood pressure too much may lead to heavy checkmark dizziness and lightheadedness when changing positions, increasing the risk of falls. Heavy checkmark reduced blood flow to the brain, which may raise the risk of memory loss or cognitive decline. Heavy checkmark increased reliance on blood pressure medications, even though some patients can manage their blood pressure through diet and lifestyle changes. Additionally, some doctors are skeptical of research studies funded by pharmaceutical companies. They worry that recommending lower blood pressure targets may increase the number of people needing medication, ultimately benefiting the pharmaceutical industry. 3. Inconsistent research findings. While large-scale studies have shown the benefits of keeping blood pressure below 120/80 mmHg, debates still exist regarding the ideal blood pressure for different groups. For example, some research suggests that adults over 80 years old may be safe with slightly higher blood pressure levels, as long as they do not have severe cardiovascular complications. Other studies are exploring differences between daytime and nighttime blood pressure and how blood pressure levels affect memory and kidney function in older adults. Because of these ongoing debates, there is no single perfect number for everyone. Instead, Each person should consult their doctor to determine the most suitable blood pressure level based on their individual health condition. Changes in blood pressure standards over time. Blood pressure standards have changed significantly over the decades, based on medical research and a deeper understanding of how blood pressure affects cardiovascular health. Before 1996, 160/90 mmHg was considered hypertension. For many years, a blood pressure level of 160/90 mmHg was used as the threshold for diagnosing hypertension. At that time, many experts believed that increasing blood pressure with age was normal, and older adults could maintain higher blood pressure without significant intervention. However, later studies revealed that even a 140/90 mmHg reading increased the risk of heart disease and stroke. 1996 to 2017, lowering the threshold to 140/90 mmHg and 130/80 mmHg. In 1996, the American Heart Association, AHA, updated its guidelines, stating that blood pressure of 140/90 mmHg or higher should be considered hypertension. The previous belief that 160/90 mmHg was acceptable was no longer valid. In 2017, after a large study on 9,000 patients, experts further lowered the hypertension threshold to 130/80 mmHg, as data showed that cardiovascular risks remained even with blood pressure below 140/90 mmHg. 2024, new guidelines, 119/79 mmHg or lower. Currently, top medical organizations, such as the AHA, Harvard Medical School, and the National Institutes of Health (NIH), recommend an ideal blood pressure of 119/79 mmHg or lower for older adults. This level provides the best protection for the cardiovascular system, significantly reducing the risk of stroke, heart failure, and other complications related to high blood pressure. Over the years, blood pressure standards have shifted toward lowering the safe threshold, reflecting advancements in medical science and a better understanding of how blood pressure impacts overall health. Maintaining an optimal blood pressure below 120/80 mmHg can help extend lifespan and prevent serious diseases. Blood pressure classification according to the American Heart Association (AHA). The American Heart Association (AHA) and other reputable medical organizations classify blood pressure into different levels to assess health risks and guide appropriate treatment. Below are the current blood pressure classifications. 1. Normal blood pressure, normal BP. Blood pressure range, less than or equal to 119/79 mmHg. Health condition, ideal level with minimal risk of cardiovascular disease. Advice, maintain a healthy lifestyle, exercise regularly, and follow a balanced diet to keep blood pressure stable. 2. Elevated blood pressure, elevated BP. Blood pressure range, 120/129/80 millimeters of mercury. Health condition, slightly increased blood pressure with a risk of progressing to hypertension if not controlled. Advice, reduce salt intake, manage stress, maintain a healthy weight, and exercise to prevent progression to hypertension stage 1. 3. Hypertension stage 1. Blood pressure range, 130/139/80/89 mmHg. Health condition, increased risk of heart disease and stroke. Early treatment is necessary, especially for individuals with underlying conditions like diabetes or kidney disease. Advice, lifestyle changes combined with medication if prescribed by a doctor. 4. Hypertension stage 2. Blood pressure range, greater than or equal to 140/greater than or equal to 90 millimeters of mercury. Health condition, high risk of cardiovascular damage, stroke, and kidney failure. Requires close monitoring and medical treatment. Advice, medication combined with lifestyle changes, regular checkups with a doctor to manage blood pressure effectively. 5. Hypertensive crisis, emergency. Blood pressure range, greater than or equal to 180/greater than or equal to 120 millimeters of mercury. Health condition, extremely dangerous, potentially leading to stroke, heart attack, acute kidney failure, or severe organ damage. Advice, seek immediate emergency care. If symptoms such as severe headache, chest pain, shortness of breath, or vision loss occur, call for medical help right away. Effective ways to control blood pressure. Maintain a healthy diet. Eat plenty of vegetables, fruits, and potassium-rich foods while reducing salt and saturated fat intake. Exercise regularly. Activities like walking, yoga, swimming, or any suitable workout can help maintain healthy blood pressure. Limit alcohol and smoking. Stimulants can increase blood pressure and negatively affect cardiovascular health. Manage stress. Meditation, sufficient sleep, and a positive mindset help keep blood pressure stable. Monitor blood pressure regularly. Check at home or schedule regular health checkups to track your blood pressure levels. Understanding blood pressure classifications and maintaining a healthy lifestyle will help older adults protect their heart health and improve their quality of life. Differences in blood pressure guidelines. Understanding the variations. Although the American Heart Association, AHA, and the National Institutes of Health, NIH, have updated the standards for ideal blood pressure, there are still differences in guidelines from various medical organizations. This has caused confusion, especially among older adults and those monitoring their blood pressure for cardiovascular health management. Different blood pressure standards. Some insurance companies and medical organizations still use older standards to assess blood pressure, such as normal blood pressure, 90-119/60-79 mmHg, prehypertension, 120-139/80-89 mmHg, hypertension stage 1, 140-159/90-99 mmHg, hypertension stage 2, greater than or equal to 160/greater than or equal to 100 millimeters of mercury. In contrast, the updated AHA guidelines from 2017 classify blood pressure more strictly. Normal, less than or equal to 119/79 mmHg. Elevated blood pressure, greater than or equal to 120/80 mmHg. Hypertension stage 1, 130-139/80-89 mmHg. Hypertension stage 2, greater than or equal to 140/greater than or equal to 90 millimeters of mercury. Hypertensive crisis, greater than or equal to 180/greater than or equal to 120 millimeters of mercury. According to these new guidelines, a person with a blood pressure of 130/80 mmHg, previously classified as prehypertension, is now considered to have hypertension stage 1. How different guidelines affect diagnosis and treatment. These differences can impact diagnosis and treatment, particularly for older adults. Some patients may be classified as hypertensive under the new guidelines, but may not qualify for treatment under insurance policies that follow the older standards. This could result in missed opportunities for early treatment, increasing the risk of cardiovascular complications. Additionally, doctors may face challenges in advising patients, as not everyone is familiar with the updated standards. This highlights the need for better coordination between medical organizations and insurance providers to ensure patients receive appropriate treatment. Advice for older adults. Always consult your doctor to determine the appropriate blood pressure range for your health condition. Regularly monitor your blood pressure at home to detect any abnormalities early. Don't panic if your blood pressure falls into the prehypertension range based on older guidelines, but take proactive steps to maintain an optimal level. While differences in medical guidelines can cause some inconsistencies, the most important goal is to maintain stable blood pressure and follow your doctor's recommendations for cardiovascular health. Is there a universal ideal blood pressure? In medicine, there is no single ideal blood pressure that applies to everyone. Each individual has unique physiological factors that influence how their body regulates blood pressure. No one-size-fits-all blood pressure level. Medical experts agree that 119/79 mmHg is an ideal level according to recommendations from major health organizations. However, in reality, the optimal blood pressure range can vary based on several factors. Age. As people age, blood vessels lose elasticity, leading to naturally higher blood pressure. For individuals over 60 to 70 years old, a blood pressure level below 130/80 mmHg may still be considered acceptable. Underlying health conditions. People with diabetes, chronic kidney disease, or a history of stroke may need stricter blood pressure control. Overall health status. Some individuals naturally have lower blood pressure without health issues, while others may need a slightly higher level to maintain normal physiological functions. Can older adults accept higher blood pressure levels? Some research suggests that slightly higher blood pressure may not be harmful to certain older adults, as long as it does not lead to serious complications. For example, a blood pressure of 130/80 mmHg in a healthy older adult may not be a major concern. If blood pressure drops too low, it can cause dizziness, falls, and a reduced quality of life. For this reason, doctors evaluate the overall health of each patient before determining the most appropriate blood pressure target. Conclusion: the ideal blood pressure level is 119/79 mmHg, but not everyone needs to achieve this exact number. Medical organizations may provide different recommendations based on research and target populations. The key is to control blood pressure flexibly, based on individual health, rather than strictly following a single fixed number. Recommendation: always consult your doctor for a personalized blood pressure management plan that suits your body's needs.